Hey there, Christophe from the French Herbal. Today I'd like to talk to you about dead nettles. You'll find those plants just about everywhere in the countryside, and yet we don't really talk about them much in herbalism. It's just as if they're useless, and I don't think that's quite accurate. Some dead nettles seem to be quite active to me. The most classic in our herbal Materia Medica is white dead nettle, and that's the one I'd like to present to you today. And this one, I can place it pretty well on our herbal map in terms of properties and indications. Might be a bit of a caricature, but I think it will help us to see when to use it. I'm going to talk about two main areas of use. The first one concerns everything related to discharges from the uterine sphere. And the second one concerns states of abundant secretions in the upper respiratory tract. And don't worry, I'm gonna break all this down in this episode. But before we start, I'd like to remind you that I'm neither a doctor nor a pharmacist nor a healthcare professional. I'm here to share my passion with you, but this in no way replaces medical follow-up, nor is it meant to be diagnosis or medical prescription. All right, let's begin with a bit of botany. If I tell you square stems, opposite decussate leaves, so that means the ensemble of leaves, if you look at it from the top, they look like a cross. Bilabiate flowers, so two lips looking like an open mouth. Tetrachine fruits, meaning four seeds forming a square. And if you guessed, then yes, we're talking about the Lamiaceae family here. The genus in question today is Lamium, what we call dead nettles. We have quite a few dead nettles in our countryside. We have a henbit dead nettle, yellow archangel, spotted dead nettle, purple dead nettle, etc. And the one we're talking about today is white dead nettle, Lamium album. Its global distribution is very wide. It spans across Europe and Asia, and it's been introduced and naturalized in the UK and North America. You'll find it in forests, in wooded areas, meadows, embankments, riverbanks, roadsides, trails, etc. And well, it's very common in France, except over here in my region in the southeast of France, in Provence. Unfortunately, I don't have it here. It often grows in fairly rich soils near human settlements, and it tolerates both shade and full sun. Pretty easy to grow in the garden, I hear. That said, I've never cultivated it myself. The plant spreads by stolons. These are creeping aerial stems that make little rootlets at the nodes, and it also spreads by seeds. The seeds germinate after a dormancy period, often triggered by cold and moisture. The leaves are heart-shaped with serrated edges resembling nettle leaves, but without the stinging hairs, right? And the plant is hairy, but it doesn't sting. And in fact, the name dead nettle comes from this resemblance, right? The term appears in the Old English text as early as the 1500s, maybe earlier. And dead here likely means false or harmless, and not the plant is dead, obviously, right? The bilabiate flowers are grouped in verticils of 6 to 8 flowers located at the leaf axils, and they give rise to a 4-seeded fruit, again characteristic of the Lamiaceae. The parts we used are the flowering tops, and some authors like Rudolf Weiss, the famous German herbal doc, mention only the flowers. I find that the entire above ground flowering parts are useful. Just remove the thickest square stems, which aren't very interesting. I've even used just the leaves, and the effect seems pretty good to me. Fournier, a classical French author, mentions that the roots and the stems can be useful to slow down bleeding, suggesting that these parts are probably at least rich in tannins, but they're far less interesting than the rest of the plant, the leaves and the flowers. In terms of constituents, here we have lots of flavonoids like quercetin, isoquercetin, and rutin. We have phenolic acids like caffeic, chlorogenic, ferulic, gallic, coumaric, vanillic acids, lots of them. We have iridoids, and these are recognized as the main active constituents of white dead nettle. There is an essential oil that gives the plant its distinctive and not very pleasant odor. We have some mucilages, not much though. It won't feel slimy to the touch or in the mouth. And tannins, not a lot, but enough to give an astringent effect. Rudolf Weiss mentions up to 5% of tannins by dry weight, which surprised me given how mildly astringent it tastes. Compared to other astringent herbs. This overall profile of constituents suggests very strong antioxidant and anti-inflammatory properties. The smell and taste are hard to describe. It's strong, pungent, almost fetid, not pleasant, but the intensity fades when dried, meaning that the unpleasant taste is probably mostly due to the aromatics, and that those aromatics will dissipate quickly in the dried plant. So don't let it age too long on a shelf before you use it. American herbalists describe its energetics as warming and drying. The drying part makes sense to me. The warming effect is a little more subtle to feel, but it will fit some of its indications for chronic and cold condition, lacking warmth and circulation, especially when we talk about women health. Okay, let's move on to properties and indications. So, white dead nettle is a common herb with many traditional uses. It was used for diarrhea, bloating, water retention, skin problems, winter infections, but I'm going to skip those classical uses, and instead I'll focus on two key areas where I think this herb is very interesting. Now, I need to take you back about 20 years. I was on a plant walk with one of my first herbal teacher, and we were looking at all those unassuming mints, not flashy aromatic like thyme, oregano, peppermint. We were looking at the dead nettles, the hedge nettles, etc. And I asked the teacher, I said, if it's a Lamiaceae but not a classic aromatic one, and it has this kind of a weird, almost foul smell, what does that tell us? And the teacher said, at a minimum, these are excellent anti-inflammatory and drying herbs for the upper respiratory tract. And it took me years to fully grasp what he meant. And here is what I think it means. So first, the location where it works best. The upper respiratory system, the nose, sinuses, throat, and even the middle ear, like in the case of an ear infection with lots of congestion. If these areas are inflamed, these herbs can calm the inflammation. They're also drying, meaning that they reduce the amount of discharge happening at the mucous membrane, like post-nasal drip. And to me, this is more adapted for chronic or allergic issues, a lot more than acute infections, right? So think chronic or allergic rhinitis, sinusitis, pharyngitis with inflammation, with excessive and clear mucus production. And here the tannins, the flavonoids, the phenolic acids, the mucilates, the iridoids, this unique combination will help to reduce the inflammation and calm the secretions. It pairs very well with plantain, with goldenrod, with blackcurrant leaves for these conditions. Blackcurrant leaf is a traditional French remedy. I'll talk about it another time. Now, if it moves down into the lungs, so that would be the lower respiratory tract, then this is not the herb for that. A quick pause to let you know that you can grab my free ebook on preparing herbal teas for the 4 seasons. It's full of simple recipes and blends you can make with herbs you can buy or even grow almost anywhere. The link is right below this episode. I hope you enjoy it. The second key indication is for excessive discharges of the female reproductive system, whether we talk about blood or mucus. And the classic indication here is leukorrhea. which is abnormal vaginal discharge. Rudolf Weiss, the herbal doc who pretty much revived modern herbalism in Germany, he explains that after ruling out pathological causes like fungal infection or parasites or worse, cancer, then you're left with some kind of a constitutional leukorrhea, often seen in young women, he says. And if those discharges are bothersome, then Weiss recommends internal use of uterine tonic herbs and silica-rich herbs to strengthen tissues and support collagen formation. So he recommends yarrow, horsetail, lady's menthol, and white dead-nettle, and that makes a great blend. For white dead-nettle specifically, Weiss adds that external applications like sitz bath can complement the internal use, but he stresses that we must be combining it with uterine tonic herbs like yarrow for best results. And as a side note, Weiss is talking about non-pathological leukorrhea, but if there is an identified cause like candida overgrowth, then this herb and the blend I mentioned will be pretty useful internally and externally. Henri Leclerc, one of our French herbal docs of years past, he shared different success stories. A young anemic girl, so think cold and pale constitution, with heavy menstrual bleeding and leukorrhea, he says white dead-nettle juice resolved it. Then he talks about an older woman with a fibrotic retroverted uterus. He says a tincture of the plant controlled her Metrorrhagia, which is abnormal uterine bleeding. The protocol from Henri Leclerc is quite interesting, and listen to this. He says 30 drops of the tincture every 30 minutes, up to 5 to 20 grams of the tincture per day. That is roughly 1 to 5 teaspoons divided into frequent doses throughout the day. And yeah, that's a lot of tincture. And this pulsed dosing, as we say, is something I've recommended, and I've seen it work remarkably well in some cases. Although I have not gone up to those total amounts in terms of number of teaspoons, right? Okay, now let's hear it from Valnet, Jean Valnet, another great French herbal doc. He explains that white dead-nettle is a uterine-specific remedy. He emphasizes two indications, leukorrhea and Metrorrhagia. So we're adding Metrorrhagia to our list, which is bleeding outside of menstruation. And common causes of Metrorrhagia today are fibroids or polyps. We have endometriosis, we have PCOS, we have perimenopause, and sometimes more serious conditions. So always get a medical diagnosis first. And here, white dead-nettle acts as a vascular tonic and astringent for small vessels. A little similar to red vine leaf, I had an episode on red vine leaf, similar to lady's menthol or other uterine astringent herbs. We can also use this herb for menorrhagia, so heavy periods. It's a great addition to blends for heavy flow, alongside classics like lady's menthol and red raspberry leaf. Okay, I'll stop here for the indications. As I said, the plant can do so much more, but narrowing it down to two key areas, it helps us to place it in our herbal toolkit. That said, I can't resist giving you one last use mentioned by several classical authors, lung bleeding. And the term used here is hemoptysis. And this is seen in lung cancer or tuberculosis, which are strictly medical conditions to be handled by your physician, as you can imagine, but I wanted to mention it. In terms of preparation and dosages, the tea remains the traditional form. The taste is not great, but it's manageable. It's pretty earthy. It's like spinach tea. It's got this mineral, slightly salty, bitter, little astringent note. And of course, you can add herbs for taste like peppermint, lemon verbena, or licorice if not contraindicated. 1 tablespoon of the chopped dried leaves or flowers per cup. Valnet recommends boiling it for 10 minutes, so technically a decoction. 2 to 3 cups per day between meals, although the simple infusion of the leaves, not necessarily a decoction, will work too. The tincture, 2 to 4 teaspoons per day as Valnet suggests, and think of pulsed dosing for uterine bleeding situation, so the 30 drops every 30 minutes. For external use, a handful of dried plant in a liter of water, boil it for 10 minutes for a sitz bath, for instance. And here is a recipe that you can find in several classical French books. It's a syrup made from the tincture. So 100 grams of white dead nettle tincture, 50 grams of simple syrup, which is a sugar syrup, and 25 grams of water. The recipe is on my website. You don't need to write this down. Fournier recommends 1 teaspoon of the syrup every 30 minutes until bleeding stops, and then 1 tablespoon every 4 hours. So some kind of a pulsed dosing with the syrup as well. In terms of precautions, I haven't found anything in classic texts nor in modern ones. And you know, this herb is rarely mentioned. It rarely has a full page, a full monograph in modern herbal books. But that doesn't mean there are not any modern precautions or contraindications. It's just that nothing has been documented to date. And that's all I had to tell you about white dead nettle. I really think this herb has its place in modern practice, and I hope this episode helped you to see where it fits. Thanks for listening, and I'll see you very soon for another episode of The French Herbal.